If breakfast could quietly lower the strain on your kidneys every single morning, would you change what's on your plate? Today we'll build a kidney-smart breakfast you can make in minutes, designed to support lower creatinine, steadier blood pressure, and better energy. We'll start with the #1 base and add simple variations you can rotate through the week. Everything here follows widely used renal nutrition principles in U.S. clinics and is intended as general education, not personal medical advice. If you live with chronic kidney disease, diabetes, or specific potassium or phosphate restrictions, confirm details with your clinician or a renal dietitian. Creatinine is a normal byproduct of muscle metabolism that healthy kidneys remove. When kidneys work less efficiently, creatinine can rise. Morning choices influence filtration workload, sodium balance, blood pressure, inflammatory tone, and glucose stability for the rest of the day. A kidney-friendly breakfast puts fiber first, prioritizes plants and healthy fats, keeps protein moderate to avoid excess filtration stress, lowers sodium, and limits refined sugars and saturated fats. The headline option is a fiber-first oat bowl. Use plain rolled or steel-cut oats cooked in water or unsweetened almond milk to keep the potassium and phosphorus load lighter than with dairy. Soluble fiber in oats slows protein absorption and supports the gut-kidney axis, so more nitrogenous waste is handled in the intestine instead of relying solely on renal filtration. A practical portion is about 1/2 cup dry rolled oats or 1/3 cup steel-cut per serving, simmered to a creamy texture in roughly 5 minutes, or prepare overnight oats by soaking 1/2 cup oats in 3/4 to 1 cup unsweetened almond milk. Keep it simple. No sugary packets or syrups. Add gentle, kidney-smart toppings in measured amounts. 1/4 to 1/2 cup diced tart apple for pectin and natural sweetness. 1 teaspoon ground chia or flaxseed for plant omega-3s that support vascular and inflammatory balance. 1/4 cup blueberries or raspberries for polyphenols with a low glycemic impact. A sprinkle of cinnamon for flavor without sodium. If you need extra calories, use a small amount of natural almond butter rather than large scoops that push the fat and calorie load too high. This bowl works because fiber moderates digestion, omega-3s help quiet low-grade inflammation, reduced sodium protects blood pressure, and a steady glucose curve limits vascular stress. Personalize sensibly. If you're on a low potassium plan, keep fruit portions small and favor berries over banana. If phosphorus is restricted, prefer water or almond milk over cow's milk, unless your dietitian says dairy fits your labs. If you require higher protein for medical reasons or training, set amounts with your care team. For variety, rotate 4 additional kidney-smart patterns that follow the same principles: fiber first, modest protein, low sodium, heart-healthy fats. A spinach berry smoothie offers antioxidants and hydration with an adjustable potassium profile. Blend 1 cup unsweetened almond milk, a small handful of baby spinach, 1/2 cup blueberries or strawberries, and 1 tablespoon ground flaxseed until smooth for a 10 to 12 ounce serving. If potassium is restricted, reduce spinach to a few leaves and emphasize berries. Avoid sweetened yogurts or syrups. A whole grain toast with a thin spread of almond butter gives gentle plant protein and fiber. Toast 1 slice of true whole grain bread with less than 120 milligrams sodium per slice, spread 1 to 2 teaspoons natural almond butter, and add cinnamon or a few blueberry halves. Skip processed meats, high-sodium spreads, and protein-packed products loaded with salt or phosphates. A brown rice congee with small red beans and extra virgin olive oil provides a soothing, savory option. Simmer pre-soaked brown rice into a thin porridge, stir in a small portion of well-cooked small red beans for gentle plant protein and fiber, finish with 1 teaspoon olive oil and a touch of white pepper or ginger. Keep sodium down by avoiding soy sauce and packaged soup bases. An avocado lemon mash on unsalted brown rice cakes is a fast, low-sodium choice. Mash 1/4 to 1/2 small ripe avocado with fresh lemon juice. Spread thinly over 2 unsalted rice cakes and add cracked black pepper or herbs. If potassium is restricted, keep the avocado portion small and rely on herbs for brightness. Across all patterns, remember that kidney-conscious breakfasts are not high-protein gym meals. Most adults do well with modest protein in the morning, unless a clinician advises otherwise, because excessive protein, especially from animal sources, raises filtration workload. If you need more protein, consider a small serving of unsweetened soy yogurt or a measured scoop of a renal-appropriate plant protein approved by your dietitian. Watch sodium, the silent morning overload hiding in breads, flavored oat packets, spreads, deli meats, and breakfast sausages. Target under approximately 300 milligrams sodium at breakfast when possible, flavoring food with cinnamon, vanilla extract, lemon, berries, ginger, or herbs rather than salt. Potassium and phosphorus should match your labs and stage of kidney function. Potassium is essential, but some patients must limit it. Phosphorus from processed foods and some dairy can accumulate. Read labels for phosphate additives and minimize ultra-processed items, personalizing with your care team. Limit added sugars and refined carbs, such as sugary cereals, pastries, and syrups that spike glucose in stress vessels. Choose whole grains and measured fruit instead. Coffee or tea can fit for most people. Keep them simple, black or with a small amount of milk or unsweetened almond milk, and avoid sweetened creamers and syrups. Respect any fluid plan from your clinician. Start the day with water alongside breakfast unless you're on a fluid restriction. A squeeze of lemon adds flavor without sodium and may help lower stone risk in appropriate patients. To make this automatic, use a 5-day rotation. Day 1, the oat bowl with apple and chia. Day 2, the spinach berry smoothie with flaxseed. Day 3, whole grain toast with thin almond butter and blueberries. Day 4, brown rice congee with small red beans and 1 teaspoon olive oil. Day 5, avocado lemon mash on unsalted rice cakes with herbs. Then repeat or mix and match within your nutrition plan. Avoid common renal stressors in the morning. Processed meats like bacon or sausage, heavily salted spreads, instant noodles or cup soups, packaged pastries, donuts, sugar-loaded coffee drinks, and protein-packed bars or shakes with high sodium, added phosphorus, or lots of sugar. Signs your breakfast shift is helping include smoother mid-morning energy, less bloating from sodium and heavy fats, more regular digestion from fiber, steadier home blood pressure readings if you track them, and over time, lab trends your clinician is monitoring. Speak with your healthcare professional if you have CKD stages 3 to 5, dialysis, a transplant, diabetes, heart disease, high blood pressure, or medicines that alter potassium. Ask about your specific potassium, phosphorus, protein, and sodium targets, and request a referral to a renal dietitian for precise guidance. The quickest way to start tomorrow is a 1-minute prep. Half-cup rolled oats simmered in 1 cup water or unsweetened almond milk, topped with 1/4 cup diced apple, 1 teaspoon ground chia or flax, and a sprinkle of cinnamon. 5 minutes, 1 pot, kidney smart by design. Kidney protection is not about one heroic meal, but about a quiet, consistent decision you make every morning. Build your breakfast around fiber, plants, and healthy fats. Keep protein moderate, sodium low, and sugars minimal. And give your kidneys a lighter start to the day so they can return the favor with steadier, more reliable health. Disclaimer: this script provides general educational information about nutrition and kidney health for adults, and does not replace personalized medical advice, diagnosis, or treatment. Always consult your healthcare professional for guidance tailored to your labs, medications, and health status.